protesters who mobbed hospitals over vaccinations and BC's vaccination pass are planning to do it again.
It continues to be enormously frustrating, demoralizing, and quite frankly, insulting to healthcare workers that these protests are taking place in front of healthcare facilities.
Provincial leaders clear there's a place for protest, and this isn't it.
And yelling at healthcare workers serves no purpose at all.
Not saying if this will include applying for an injunction or creating a bubble zone around hospitals on the target list for Monday, but it's clear protections will be in place.
Our priority is to ensure that patients are kept well and are not in any way intimidated, and to ensure that our healthcare workers are kept safe.
The city of Vancouver, where the crowd made an ambulance driver struggle to get through near Vancouver General Hospital and held up cancer patients going to treatment, offering help and some advice.
My message, though, would be don't do this. Don't risk people's lives for the sake of making a political point.
As for people thinking they're heroes by choosing not to be vaccinated,
nothing heroic in presenting a target for COVID-19. There is nothing altruistic in attracting its infectious aim. There is nothing gained by anyone when someone falls victim to its vicious hold.
Of the 130 people in intensive care right now, 111 have not been vaccinated, 93% not fully vaccinated. More than half of those are younger than 50 years old. The irony of where these anti-vaccine, anti-mask, and anti-vax pass protesters are targeting, not lost on health professionals.
And some of them are going to need care. Some of them are going to need to be in hospital. Some of them are going to need oxygen, and some of them will end up in the intensive care unit.
For City News in Victoria, I'm News 1130's Lisa Yusta.